and then we'll go ahead and get started. All right. Okay. All right. So we are in week 9, literally the home stretch. We are almost done. So, how did you guys feel about week 8? You guys did education and training. You had, what did we do? We did the educational websites. We also did how to keep a journal. How did you guys feel it went? Were there any barriers? Give me some feedback.
It went really, really well. I really appreciate the fact that instead of people being able to tell others how they feel, them being able to write their feelings down so they have something transparent to put names to those emotions. Me and
Mhm.
my clients really enjoyed it. Yeah, thank
Yeah,
you.
yes. How about some other people? Did you feel like it was an easy intervention or activities to incorporate in the session, or it just didn't come naturally this week?
I didn't have anybody who wanted to practice journaling or like writing down their thoughts.
They're like, nope, but you still found a way. So that's why you had that other option, right? Like, okay, well, let me educate you on some diagnosis. Let me educate you on your symptoms. So you still were able to incorporate some activities in there. So that's great. But maybe one day you'll get somebody to want to journal with you. Did anybody have anybody or any client that did a non-traditional way of journaling? Like not your typical just pen and paper. Did anybody prefer maybe like the apps, or did someone prefer to do, who was that? Stormy had suggested the video journaling or any other type of journaling. Did anybody use any other? If you guys are writing in the chat, just know I cannot see that. So just shout out your answers.
I didn't write about this in the homework, but I did have somebody. I have a gentleman and he has pretty severe Parkinson's, but he has a iPad and he uses it all right for the most part. You know, he has a handle that he can use, and so he started with the video journaling because it really helps him to talk
Oh,
and get stuff out. And so he started that last week. And so I'm excited to see if he's going to continue doing it and if it is does help him because he really enjoys talking and it gets him down that he can't write.
really cool. I like that. Maybe
Mhm.
by the time it's time for you to submit your notes for the final, maybe he will have engaged in that and you could submit one of those notes for the final. Like that would be really cool.
I hope so, yes.
Yeah. All right. Anybody else? Any challenges that you face? No, y'all like, let's get into week 9, Letitia. Like, stop talking about week 8. Like, we're ready to move on. That's fine. I'll move on. But all right. Okay. So, as we always do, we're going to start with the OAC. So, according to the Ohio Administrative Code, mental health interventions are interventions that address symptoms, behaviors, thought processes, etc., that assist an individual in eliminating barriers to seeking or maintaining education and employment, and activities that increase the individual's capacity to positively impact his or her own environment. Okay, so that is their definition. Now, before we get into class today, I just want to caution you guys that you all are, of course, TBS specialists, right? So you're TBS specialists, not therapists. So when it comes to that, you all reinforce what clients learn in therapy. An easier way to think of this is that the therapists, they're the teachers, okay? And you all, as the TBS specialists, you all are the implementers or you all are the doers, okay? So when you're working on any type of evidence-based intervention, you just want to make sure you're coordinating with the therapist. If your client does not have a current therapist that is attached to their treatment, it's okay. You all each have a clinical supervisor that is attached to you. Okay. So just, coordinate with your clinical supervisor on anything we go over. All right. All right. So let's jump in. So when it comes to implementing mental health interventions, that is going to require most of the interventions that we have covered so far within TBS University to be implemented either prior to or in conjunction at the same time as you're doing this particular intervention. So you can easily incorporate and select the intervention of coordination at the same time you're selecting mental health interventions on your progress notes. Okay. So, because you could just be working on multiple things. So, we can easily see you have mental health interventions, but you could also have selected skill building, achieving independence, ongoing assessment of needs, so forth and so on. All right. So, this is getting into the decisional balance matrix. So I tried to make sure I got that email out to you guys earlier than usual. So I make sure you had it yesterday because I wanted you to have a little bit more time to look at the handout. So did you guys have a time to some time to look at the decisional balance matrix? A little bit? Yes. Stormy's like, absolutely not. Like,
I looked at it, but the one I looked at was blank, and I did want more explanation. It ain't just had this filthy, and I got one that's like this.
yeah. No,
I
I
might.
sent you the blank one. Nope, I sent you the blank one. No, I just
Okay,
want to make
yeah, I
sure you
need that.
have.
I looked at it, but I was confused. I don't know what.
I did see the blank one too, Easter. I
Okay,
see
yeah,
the blank one,
yep,
but
okay. So this is what, and that's probably my bad because I don't have up on the screen what I actually sent to you, right? Now, can you see? Does this make more sense? All right, this is what I sent you, okay? So when it comes to the decisional balance matrix, I wanted to get this to you ahead of time. Again, we're just looking at the intro into the decisional balance matrix right now. But the DBM, that's a small part of what's called motivational interviewing. Okay. So we're going to be breaking down this decisional balance matrix over the next couple of slides. We're even going to watch a video to go over what it is. You guys are going to be required to fill in and submit a decisional balance matrix as part of your homework this week. Okay. So when it comes to a decisional balance matrix, it is a fancy pros and cons list. Okay. So, you have your pros and cons list, you have your pros, you have your cons. With the decisional balance matrix, it's just taking those two lists and breaking them up into 4 boxes. So you have your pro, con, pro. All right. It's just moving it around. All right. That's all it is. So you have the good things about changing, you have the not so good things about changing, then you have the not so good things about changing. It goes like this. And then you have the good things about changing. All right. That's all it is. All right. So that's just a part of motivational interviewing. All right. Okay. So now I did just mention something called motivational interviewing, right? So I will give you guys a brief overview of what motivational interviewing is so that you can understand the basic concepts and how you can help your clients within therapy. So before we get into the concepts of motivational interviewing, let's just look at how it's defined by psychologists William Miller and Stephen Roenick. Okay, can someone go ahead and just read this definition for me? This quick overview.
I'll read it.
Thank you, Marlene.
No problem. MI is a collaborative, goal-oriented style of communication with particular attention to the language of change. It is designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion.
You. Okay. So motivational interviewing, that is more of a way of communicating with your clients and you're listening for your client's level of readiness for change. And then when you hear that your client is ready to make a change, your job is to point out that readiness. Okay. So you're just like making your client more aware that, oh, hey, I hear that you're ready to make a change about something in your life. Okay. So you are working with your clients rather than assuming that position of like authority or that, yeah, I'm the expert, so you have to make this change because it'll make your life better. You don't want to take that position. You just want to point out that your client has stated they are ready to make a change. Okay. So when we talk about that in motivational interviewing, that change talk or change language, that refers to your client's language that expresses some sort of desire, ability, some sort of reason or need to change. And that is the key indicator of motivation. And it's also a predictor of successful behavior change. Like your client now, when they engage in these different changes, they are going to be more successful because it's something that they want. Okay. So with change talk, that is seen as a crucial element in motivational interviewing because it suggests that your client is moving towards that change. So then you're going to come in as the clinician, and then you act as the guide. You're going to have those clarifying questions where you can point out your client's strengths, their aspirations. You're listening to their concerns. You're boosting up their confidence and their ability to even make a change. And then eventually you're going to be collaborating with them on trying to come up with a plan to implement that change. So here on your screen, you see a lot of different examples of some items that you may hear from a client. So some examples of change language could be, I really want to lose weight. I can't keep eating this way. I could quit drinking. I'm going to exercise more often, or if I stick to taking my medication, then I would have better control over my diabetes. Okay, so those are just some examples of things that you could hear. So can you guys tell me of anything that you've heard your client say? And it doesn't have to be about weight or drinking or things like that. Just anything in general you've heard your client say where you're like, light bulb, they're ready to make a change. They want different for themselves. Anybody have that? Nobody has ever had a client that wants to change anything about them. Maybe they're ready to be more social, but their language has changed and they're like they need to be more social. They see that there's a need within their life, so they have a little bit more urgency to make friends because they see it'll help their depression. Right? Anybody heard anything like that?
I have
I
a
had a client who would just be negative all the time. And like, I heard them say, like, I really do need to start being more positive and speaking life. So we kind of just built off of that.
Okay. Okay. Good. Anybody else?
I have a resident who lives in an assisted living community, and a while ago, they had the opportunity to change tables because they treat it like assigned seating for where they all eat. They all come to like the same dining room and eat. They all treat it like assigned seating, even though no one has ever like told them where to sit or anything like that. And it took about like a probably a good 2 months to convince them to take an opportunity to change to another table because they were really tired of the people they were sitting with.
Mm-hmm.
And eventually they did, and they're like way happier with lunch. They don't complain about the same people and like the same topics of conversation like they used to.
Okay. Good. But they had to want it, right? So they wanted a shift. And when they wanted it, that's when you guys were able to take action, right? That's the key part that we want to make sure we're hearing is that they are ready for a change. Excuse me, because we as clinicians, we can come in easily and say, oh, well, if you would just change that one simple thing, like life would just be so much better, right? But they have to want that change. It can't be us wanting that change for them. So we're listening for that change language. Okay. All right. So what does change language communicate? I kind of already talked about this already, but it's your client, they are expressing a desire, a want, a wish, a willingness to want to change, right? So your clients at that moment, they are noting that they have the ability to change. So your clients, they may be pointing out a reason for change. They may be pointing out what their motivation for change is, or even the end goal. So when I talk about a reason for change, um, they could say, well, what's a reason for change? Or a motivation for change, right? Let's say they want to spend more time with their children, but their children don't really care for them, or they have a specific behavior or trigger that their children don't like. So that's what's keeping their children away. So if they change that one thing, then their children will come around. So that will be their motivation for change. So if I can see my children more, then I need to change this behavior. Okay. Or their end goal of, okay, well, I could quit drinking. And if I quit drinking, then I won't be hungover So their goal is to not be hungover so that they can function the next day. Okay. So they're pointing out those different things. That's what that change language is communicating. And there has to be some level of urgency for your client to change either right then or very soon in the near future. Okay. So that's what that change language is communicating. All right. So, according to the most current version of Miller and Rolnick's study, they're saying that motivational interviewing contains three key qualities. Okay. So, the first quality is what you see here is that motivational interviewing is a guiding style of communication that sits between following, which is good listening, and directing, which is giving information. So basically, it just sits between the extremes of simply following your client's lead and listening for change language. And then you're going to directly either give advice or instruction. Okay. The second key quality to motivational interviewing is designed to empower people to change by drawing out their own meaning, importance, and capacity for change. So motivational interviewing, that is based on a respectful and curious way of being with people that's going to facilitate the natural process of change, and it's going to honor your client's autonomy. And then the third key quality to motivational interviewing is that it's not a way to get people to change. That's so very important, okay? So when we think about why is it important to note that we're trying to not convince our client to change, but instead we're trying to help them find their own reasons to change, is because motivational interviewing is about helping your client decide what to change, when to change, where to change, why to change, and how to change. Okay. Again, we can't do it for them. We can't establish their reasons for them. These have to be things that are within them. Okay.
So, sorry, real quick. I I'm thinking of a couple of different clients that I have in particular. Um, we do a lot of the motivational interviewing, and they're able to identify all of these things. But when we kind of come to the end of it, and I'm like, okay, so like you've figured out what changes you could make and the benefits of it, this is what you want to get to. And then they're like, well, yeah, but I'm not going to do it. So, like, how would that fit into this? I see a lot of that. It's like, yeah, but I would rather be stuck in this than do the changes that it would require to reach what I'm saying I would rather, like, want.
So what you are describing right now is what we're going to get into later today, but it's talking about the stages of change. So your client can be at a different stage of change where they acknowledge that there's a need for me to change, but you know what? I'm just not ready to make that change right now. So, and we're going to talk about that a little bit more. You have to know what stage of change your client is in before you know what steps you need to take as the clinician. Okay, but that's a great question. But
What
again,
is
oh, go ahead.
what when I'm looking at the matrix, because like I'm taking notes, would it still be appropriate to use the balance matrix?
Yeah, definitely. Even if they're
Okay.
still at like the pre-contemplation stage of change where they don't really know if they want to make a change, but they're kind of acknowledging that I need to make a change about something, that's exactly when you want to use that decisional balance matrix, right? Because what are the pros and cons of if I were to make a change or if I were to just keep everything the same and not make a change at all? So even if they haven't fully determined that they want to make a change, that's when you want to use that decisional balance matrix. Okay, because this is how you're going to help them to determine if they should make a change or not. Okay, good. All right. So, with motivational interviewing, so that is particularly useful to people to help people examine their situation and the different options when any of the following are present. Okay. So, if ambivalence is high, so that's just saying if people are stuck in mixed feelings, kind of like what Indy was talking about, right? So maybe they have strong feelings about changing, but they also have some strong feelings about not changing, like, do I, will I, should I, that type of stuff, right? Or maybe their confidence is low. So maybe people are doubting that they even have the abilities to change. or their desire is low. And people could be uncertain about whether they want to make a change or not, or the importance, it's really not that important to them, right? So their importance is low, and the benefits of the change and the disadvantages of the current situation is just really kind of unclear to them. So you're going to look for those indicators to determine if motivational interviewing might be helpful for your clients in implementing that decisional balance matrix. Okay. So we're going to watch a lovely video from this young fella here. This is Dr. William Matulich. He's an author, experienced psychologist. He is a distinguished public speaker. His accolades go on. And I feel like I'm introducing him like he's about to walk into the room or something. He's not. We're just going to watch a video on him. So he is going to give us an introduction or give us a full overview of completing a decisional balance matrix and using motivational interviewing. So we're going to go ahead and watch this. Take notes if you have questions on completing the DBM afterwards. Don't worry, we're going to go over all of that and break down each box after the video. So let's go ahead and watch.
Hello, everybody. This is Dr. Bill Matulich. I'm a clinical psychologist, a motivational interviewing trainer, and the author of the ebook, How to Do Motivational Interviewing, a guidebook for beginners. Today I'm speaking to you from my obviously plush and high-tech studios here in San Diego, California. Got my high-tech chart up here behind me. And today what I'd like to talk to you about is motivational interviewing. Now, you probably already know that motivational interviewing is an evidence-based, best practices approach for helping people change their behavior in healthy directions. Now, in a lot of situations in which we're sitting down with our clients and talking to them about changing their behavior, it's usually the health professional that's the spokesperson for change. It's usually the health professional that comes up with the arguments for change and tells the client what will happen if they change, what won't happen if they don't change, and lets them know what the consequences of their behavior are and so forth. The assumption is that if the client knows all of the information and understands the consequences of his or her behavior, then change should just be automatic. Now, unfortunately, in the real world, it doesn't work exactly that way. There's a certain number of people who are convinced by information and by advice to change their behavior. Unfortunately, there's a lot of people that are somewhat ambivalent, at least, and sometimes downright resistant to the notion of change altogether. And these are the clients, these are the patients that we have that are somewhat frustrating for us as healthcare providers. So these are the kind of people that motivational interviewing works with to help move them towards change without creating any kind of resistance. So how do we do that in motivational interviewing? Well, one way is by using the decisional balance to elicit a client's own arguments for change. And we call that change talk. We know that the more a client will talk about change themselves, the more that they will argue for change themselves, the more likely it is that change is going to occur. And so that's what we want to encourage with our clients, is their own arguments for change. One way to do that is the decisional balance. Now, the decisional balance is not much more than just a sophisticated kind of pros and cons list. The decisional balance asks 4 questions, which are based on what are the good things and the not so good things about changing your behavior and not changing your behavior. In order to be effective, or most effective, the question should be asked in a particular order, and I'll tell you what that particular order happens to be. The first question is one that most people don't ask. It's based on what are the good things about not changing, and so the question is really, what are the advantages of the status quo? Now, the particular content, of course, of the question will depend on the behavior under consideration. So if you are a dietitian, for example, and you're working with a heart patient who's eating unhealthily, and your goal is to move that patient towards eating more healthy foods in order to be healthier, in order to have some positive impact on his heart condition, the question you might ask, if you're using the decisional balance, the first question you would ask would be, What are the advantages of your current eating habits? What are some of the good things about your current diet? You want to get the person to start talking about the behavior under consideration in a non-defensive kind of a way. And this question is really going to do that. If you're an addictions counselor, for example, and your client is using, say, crack cocaine, your first question might be something like, what are the advantages to you of using crack cocaine? What are some of the good things about crack cocaine? It's not a question that most people would ask. It sounds like kind of a silly question. Why would you ask a person what are the good things about using crack cocaine? We all know what the bad things about that are. And typically, the question isn't asked. Typically, what happens with healthcare professionals is that we tell them what the bad things are about their behavior, or we encourage them to change their behavior. We tell them how it would be good for them to change their behavior. With the decisional balance, we start with the advantages of the status quo for a couple of reasons. One is that it gets a person talking in this non-defensive way, so it short-circuits resistance right off the bat. You're not going to get much change talk there, though. The change talk starts to come with the second question. The second question is, what are the not-so-good things about the status quo? What are the not-so-good things about not changing your behavior? What's the downside of the status quo? And again, to use our examples of the heart patient and the person who's addicted to crack cocaine, the question might be, well, what are some of the downsides of your current eating? What are some of the downsides of using crack cocaine? This is where your client's ambivalence is going to start to come up to the surface. And ambivalence is a key component, a key concept in motivational interviewing. We need to pay close attention to ambivalence. But the important thing here for the purposes of this video is that you're going to start getting some change talk. The person's going to start telling you, now they've already told you what some of the good things about their behavior are. You've already made that connection with them. And now it's easier for them to start telling you what some of their concerns might be. And so that's what you're going to get here. The third question then goes back to what are the not so good things about changing your behavior. So staying in this column, the question is what are some of the downsides? What's the downside of changing your behavior? And this again is a question that's going to short circuit any kind of resistance because you're asking for your client to tell you in their thinking, what are their thoughts about what's the downside to change their behavior. You might start to get some of your clients' fears at this point. They're starting to think about, geez, what if I were to really change my behavior? What would that be like? I don't know if I can tolerate that. I don't know if that's going to be good for me. I don't know if I'm comfortable with that at all. So you're starting to get a little bit of their fears and some of their reluctance to change their behavior here. Very important information. Not much change talk there. But again, this is an area where you're short-circuiting any resistance because you're really asking to hear those difficulties. Question 4 is where you're going to get most of the change talk. This question has to do with what are the good things about changing your behavior. So what are the advantages of changing? You would ask your heart patient, what are the advantages of having a healthier diet? What are the advantages of changing your diet? What do you see as some of the good things about changing the way you're eating? Or you might ask the person who's addicted to crack cocaine, what are some of the advantages, what are some of the good things about quitting using crack cocaine? Now the important thing here is that you're getting change talk, which is your client's own arguments for change, in their own words, their own way of thinking about it. It may not surprise you that some of the things that they're telling you are things that you already know. And you could have just given them advice in this regard in the first place. But it's important to know that this is coming from the client and not coming from you. And so when it comes from the client, there's no resistance. The other thing that might surprise you is that you're getting some advantages of changing their behavior that you might not have even thought about. Something that's just particular to that person, rather than, anything more general or things that you might have thought about. And that's important information. That's really important and very key in helping your client move towards healthier change. So that's the decisional balance. What are the advantages of the status quo? What's the downside of the status quo? What's the downside of changing? And then what's the advantages or the upside of changing your behavior? Now, if you ask that question, you start to generate some change talk, and you can just kind of take off from there and continue with your conversation. Now, there's a few studies in the literature which suggest that just using the decisional balance by itself can be very useful, can be very helpful in helping a person move towards healthy behavior change. But it's probably much more likely and much more powerful, certainly, to use the decisional balance as kind of an integrated component with a full motivational interviewing session. In that session, you would be using other techniques like asking non-judgmental, open-ended questions, for example, or following up some of the change talk that you're getting with strategic kinds of reflections. And that would make this particular technique even more powerful. So I appreciate your attention. Thank you very much for listening. This is the decisional balance. Now you know how to use it to elicit change talk from your clients. If you'd like some more information about motivational interviewing, I invite you to come to my webpage,
Okay, thanks, Bill. All right. So, how did you guys feel about Dr. Bill's intro or his overview of the decisional balance matrix? Any
He
questions?
did very well at breaking it down.
I agree. I agree.
Yeah.
Yeah.
I understand the chart very well now. Now I know all I gotta get is what they want to change, and I got what we working on, and I know how to fill in the boxes. So
Good.
he did a good job.
Good. I figured if I just scare you a little bit, like, hey, look at this 24 hours in advance, you'll be like, what? You'll have some questions, but I knew you would watch the video. We'll explain it. You'll be good. Okay. So let's still just go ahead and break it down box by box, right? So, in box one, you're going to ask your client questions to identify a list of positives associated with not making any changes, okay, to whatever their target behavior or situation is. So I'm going to use the example today of if I was thinking about joining a weight loss group. I want to join a gym. I want to lose some weight, right? That's my example. So I'm going to use that example and fill out this decisional balance matrix. So in box one, if I don't make any change, if I don't go to the gym, if I don't join a weight loss group, I could write in this box, there's no extra effort on my part. I like watching TV in my spare time, so I can continue to do that. I need time to myself, and I don't have to share my weight loss struggle with others if I'm not really that person who likes to talk about those types of things in a group setting. Okay, so that can be what I put in box one. Now in box two, you guys are asking questions to identify the negatives that are associated with not making any change. So if I decided to not join the weight loss group or the gym, I could put things like I wouldn't get healthy. I would continue to gain weight, or I may not be able to keep up with my kid, or maybe my kid is embarrassed to be seen with me, something like that.
Health issues.
Health issues, yes, exactly. That would be the downside to me, like not making a change. Good job. In box three, you're going to be asking questions to identify a list of negatives associated with making changes. So, what are the downsides to me actually going to the gym and getting on my weight loss journey, right?
Not happy with the results.
Not happy with the results, yeah. Or my schedule is already jam packed. I don't have time to put anything else on there.
Missing like your shows that you were so used to
Yeah.
watching.
My favorite, because I love did y'all watch The Pit? I'm sorry. Okay, missing my favorite TV shows, right? What's something else?
Maybe it's the cost, like it's a financial burden.
Yeah, it is just way too expensive, right? Like have y'all joined the gym recently? Like they are so expensive. Yes, good job. And then in box four, right? Why isn't it working? Okay, so in box four, there we go. You're asking questions to identify a list of positives associated with making a change. So what are some things I could have in this box?
Better health.
Better health.
Mood improvement.
Mood improvement.
Being able to be more mobile.
More mobile. I can run around with that kid. Maybe he won't be embarrassed by me now, right?
I'm going to touch on Ashley. That's what I was about to say. Yep. Self-esteem, boosted self-esteem.
Yes, maybe I'm looking better. My self-confidence is up. Like those are all positives. Oh, go ahead, Ricky.
Better sleep.
Better sleep, right? Because now maybe my airway isn't obstructed, right?
What about mental health symptoms too? Maybe those get better. Depression can get better. Anxiety might get better.
Yes, I don't have anxiety about people looking at me when I'm out in public, like all that type of stuff, right? So y'all did this beautifully. So like it makes sense on how you complete this, right? It's really just a fancy pros and cons list. You just take that pros and cons list and you just break it down into 4 boxes. Any questions on that specifically? Y'all really did it. Like y'all got it. Okay. I'm so proud of y'all. All right. So now we're going to get into the stages of change. Okay. So I kind of talked about it a little bit earlier, but is anybody familiar with the actual stages of change? Like anyone know what they are without cheating and looking at what I sent out yesterday? Like anybody know what they are or have heard of them familiar? If not, it's okay.
Yeah, I don't know them in order, but I know one is like contemplation where you are thinking about it. Another one is action where you're actually making the action to change. And then I know one is maintenance, which is maintaining, not having that specific behavior. And then another one could be a relapse, which is normal when you're
Good.
trying to, but I can't think of the first one. I know it's pre something.
Yeah, you got it. You got it. Okay. You got them all, right? So if we're still using that weight loss example, like pre-contemplation, that is the first stage, right? Where maybe I'm unaware that I need to lose weight. Then you have the second stage, you have contemplation, where I'm aware that I need to lose weight, but I haven't really started doing anything. I haven't changed my eating habits or anything like that. Then you have the preparation or determination phase. So that's where I'm like getting ready. I'm printing out recipes. I'm writing out a meal plan. I'm joining a gym, getting workout equipment, that type of stuff. Then you have your action stage where you're sticking to the new food habits, you're sticking to the exercise regimen. Then you have maintenance where you're maintaining your weight loss, you're maintaining your exercise habits, your food, all that stuff. And then you have the relapse stage of change where you return to those old eating habits, you're gaining back weight, you stop exercising, things like that. All right. So here we have just a couple of different examples. I'm going to read the examples and I want you guys to tell me what stage that is. Real quick, I want you to take a picture of this. I forgot to have you guys take a picture of this or pull it up on what I sent you earlier, just so that everyone has it so that you can answer on the next slide. I can't see you all, but everybody good? Everybody got it?
No, I want this one too because the one that's in our thing is different from this.
Okay. Yeah, it has a little bit more information on the back end. So did you grab it? You got it?
I got it.
Okay. All right. Good job. All right. So this first example, and I want you guys to just yell it out, okay? So after I read it, right? So the first example of change language is if your client were to say, I'm making changes to my diet to lose weight. What stage of change is that?
Action.
Action. Yep. So they're currently doing what needs to be done. Good job. Number 2, I'm not sure there's a problem when it comes to my drinking.
Pre-contemplation.
Pre-contemplation. Good. They're not yet acknowledging that there's a problem. All right. Number 3, I'm going to start taking my medication so I can have better control over my diabetes.
Contemplation. Contemplation.
Preparation.
Preparation. Yes. Ricky, that's
Okay.
I love this. Yes. Right. So it's preparation. Y'all are funny, but this is where your client, they have a plan to reach their goal. Their plan is that they're going to start taking their medication to reach their goal of controlling their diabetes. Right. So good job, Ricky. Number 4, I'm weighing the pros and cons of my eating habits.
Pre-contemplation. No, contemplation.
Yes,
Contemplation.
contemplation.
So here they've
Yes.
acknowledged that there's a problem. They're just not quite sure if they want to work on it yet, right?
Mm-hmm.
All right. Number 5, I'm sticking to my exercise regimen and my healthy diet.
Maintenance.
Well, y'all all got that right. They've implemented it a change. and they're being consistent with sticking with it. Good. And then number 6, I'm not sure what happened. I had a plan, but I ate a box of Twinkies last night.
Relapse.
Right? That describes my life. I didn't have a box of Twinkies, but I did make a whole bunch of cookies, and me and my son sat here and ate them cookies last night. They were so good. I had a little hiccup in the road, right? So I had a relapse. I returned to my previous behavior of eating cookies before I go to bed. It happens. It's natural. Okay. All right. So you guys understand the change language, the different stages of change. So far, we good?
Mm-hmm.
All right. Good, good, good. All right. Now we're going to move into CBT, or cognitive behavioral therapy. Okay. So with CBT, that is a type of psychotherapy that helps individuals to identify and to change unhelpful thought patterns and behaviors that are negatively impacting their emotions or their actions. Okay. So with CBT, that is a structured, goal-oriented approach that is going to focus on the present, and it helps your client to develop skills to manage their problems. Okay, so therapists, they're completing the actual intervention of CBT, but you guys are coming in and you are going to utilize worksheets like the handouts we're going to look at, to reinforce what the individual learned in therapy. Okay, so is anyone familiar with the ABCs of CBT? Have you used it before? No? Okay. So with this worksheet, now, you're actually going to fill this worksheet out multiple times with your client, okay? And you're going to do that because you're going to fill in box A. And in box A, you're going to put the activating event or situation. In box B, you're going to put your client's beliefs and their thoughts about whatever they wrote in box A, okay? And then in the C boxes, you're putting in what are the consequential either feelings, emotions, or behaviors. So what's the outcome? Okay. So you're going to go through the first time with your client. You're going to have them fill in what was that activating event or situation? What was their trigger? What had them upset, right? What are their beliefs about that situation? How do they view it? Okay. You're going to have them fill that out. And then you're going to have them again fill in the C boxes. What is the outcome? All right. Now you're going to create a second handout, and your A box will be the exact same. So you're going to have the exact same trigger, event, situation, whatever in box A. Your box A will never change. Now, box B, this is where you want your client to change their belief about the situation so that then they can have their C boxes change. Okay, because if their beliefs change, maybe they can have a better outcome. Everybody
So
good?
basically, like getting them to understand it from a different point of view.
Yes, yes. Because people have more control over their beliefs about a situation than the situation themselves. And the belief is what we can actually help our client to change. We can't always change a situation, but it's out of our control. The situation is what it is. But if we change our belief about the situation, then we can get a different outcome. So getting your clients this is a way for them to visualize and actually see on paper, because you can tell them this stuff all day long, but now you have it on paper where they can visualize, all right, if this is my belief here, but if I change it here, then it gets better. Okay, so this is just a way to visualize it for them.
So could we use this? So a lot of my clients complain that they're stuck in the LTC, like they're not getting out. So would that be like the activating event or situation?
Mm-hmm. Yeah, but what change their belief about it, right? So then
Right.
how could actually living in that facility, how could it increase? How could it get better, right? What could they learn? So if they change their belief about it to where I'm not just stuck, right? And change it to, okay, I'm getting better. I'm working on myself. I'm working on my physical strength. I'm working on learning how to complete my ADLs independently. So now they've changed their belief. Now their outcome could be they could go home independently, right? So that would be a great example. Yeah.
I was also going to say that gratitude goes a long way too. Gratitude can help change somebody's perspective on any situation.
Yeah. Yeah.
I have a question. A lot of this seems a lot like it's kind of like running parallel to cognitive reframing.
Yeah,
Okay.
I don't disagree with that. Yeah.
So does cognitive reframing like also fall under, like, if we were to use cognitive reframing, could we like use that for a coping skill for like this week's homework assignment?
So with this week, you have to use one of these that we're going over. So you have to either use the ABC worksheet or you have to use, you must use the decisional balance matrix. So you have to like spell those out that you actually use those. Yes. Okay. All right. So we got our activities. We got all that good stuff out the way. So let's look at the documentation piece. So someone read Sally's situation and then someone else read starting at the goals and objectives for me, please, and thank you.
Sally's been maintaining progress made lately. She's been attending activities regularly. She's reporting only 4 to 5 panic attacks per week, which is significantly less than at intake. You're starting to think about discharge for her soon, but you want to solidify her coping skills in place first. Sally reports doing square breathing in session with you helps decrease her anxiety and improves her mood. Every week, Sally reports she wants to do yoga regularly, as well as she states that this has also decreased her anxiety and improved her mood in the past. Sally reports she has not done yoga in months, however.
Thank you, Easter. Can someone read the goals and objectives for me?
Goal 1. Sally reports her goal is to feel like myself again. Sally will reduce overall frequency, intensity, and duration of the anxiety so that daily functioning is not impaired. Objective 1. Sally will learn and implement calming skills to reduce overall anxiety and manage anxiety symptoms by using 3 coping skills weekly per self/guardian report. Do continue or somebody else?
Go ahead,
Yeah.
keep going.
Okay, goal number 2. Sally reports her goal is, I want to get out, see my friends, and have fun again. Sally will alleviate depressed mood and return to previous level of effective functioning. Objective 1. Sally will utilize behavioral strategies to overcome depression by practicing at least 3 self-care behaviors each week per self-report and staff observation.
Good, good, good. Okay. So how might you do a decisional balance matrix with her? So I want you guys to focus on the last couple of sentences here, okay? Where she has that she reports doing the square breathing, that it helps to decrease her anxiety and improves her mood. It doesn't mention anything about her doing this independently outside of session, so keep that in mind. But then it also goes on and it says that every week Sally reports she wants to do yoga regularly, as well as she states that in the past it's helped to decrease her anxiety and improve her mood. So, but she hasn't done it in months, right? So looking at those statements, how might you do a decisional balance matrix with her? What would be the focus of your decisional balance matrix?
Yoga.
Yeah, yoga. Just
Yoga.
And her anxiety.
How would the focus be anxiety for the decisional balance matrix?
I was just gonna go with good changes, bad changes for her anxiety,
Now, you would make sure
disadvantages.
you're including the anxiety in your documentation, like in the response, right? Like, we're doing this because we're trying to decrease the anxiety. So, yes, you're going to mention it, but your focus of the decisional balance matrix would be if she were to engage in the yoga again, right?
Mm-hmm.
Okay, so that would be your focus. So, good, good. All right.
Yoga.
Yeah. Okay, so we're selecting our mental health interventions. What do you guys think you would be selecting for activities?
Handout.
Yep. So you could do either one of the two. You could do the utilizing evidence-based treatment modalities handouts or the handouts provided by a therapist. Okay. So either one of those two activities. All right. So this response here, and it's not completely filled out, it's cut off, but I want you to get your feedback on how we would incorporate some things. But it says, Sally states she's been attending activities regularly and reports 4 to 5 panic attacks per week. Sally engaged in 4 rounds of square breathing in session and stated this decreased her anxiety and improves her mood. Sally reports she wants to do yoga regularly, as she states this has also decreased her anxiety and improved her mood in the past. Now, there's no mention of the decisional balance matrix. How would you, as the clinician, how would you word that? How would you make sure you get that in the response? What would you guys put?
Can I say Sally participated in the creation of making a decisional balance matrix focused on et cetera, or yoga in her case?
Okay, so focused on yoga. What else? So you're saying she engaged in it. Somebody else tell me, what else do I need to see so that I really know Sally was engaged in there? How do I really know?
Give direct quotes for what her responses were.
Yes, put some direct quotes. So in box 1, she put this. These are her advantages to changing. These are the things that she pointed out as the disadvantages. Like, I want to see those quotes in there. Okay, so yes, you are going to submit your DBM like with your quiz, but I still want to see that the client engaged within this response section. Okay, so add those quotes. Don't just say she did it. Show me she did it. Okay. All right. Let's go over that. Okay.
Okay, so I'm sorry, Letitia. So this note is opposite from our 2 final notes, correct?
Yeah, no, this is
Okay.
this is your regular homework. We haven't even got to that
Okay.
yet. Yeah, this is just your homework. Yes. Okay. So for the planner, the homework, you see it's blank. So what would you guys assign as homework for the client this week?
Maybe
assign the utilization of the matrix we just did.
That's what I was going to say, Stormy. Yeah, to see if they implemented it or what they agree on to work towards her doing the yoga. What steps has she taken?
That part. So what did she agree to do when it comes to the yoga? How often will she be doing it? Why is she doing it? Okay. Good job. All right, and then discharge, we're always looking towards discharge. But with discharge this week, you just want to make sure you're preparing your client for discharge by normalizing relapse. Relapse can be viewed as opportunities for learning and for growth. It allows your client to reevaluate their strategies and their motivations for wanting to change. Okay, so you don't want to just skip over relapse. You ensure you're setting your client up for success by educating them that relapse can happen. Most people do have some sort of a relapse. Remember, I told you I ate all them cookies last night, right? I had a relapse. It's a normal part of life. Normalize that for your clients. Don't allow them to believe that they have ever failed at something. Allow them to know that they can try again. That's what we want to see. And remember, that just goes back to what I mentioned earlier, that you can and will be doing multiple interventions at the same time. So you could be working on, that skill building, ongoing assessment of needs, all those different skills, right? You're putting everything back together, all right? But normalize that for them. Okay. Any questions? We got a little bit more to cover, but any questions about week 9? Do you guys know how you're going to be incorporating the decisional balance matrix this week?
I'm really glad that we learned it because, like, I'm just going to throw this on all my clients. Like, hey,
When whoever named that them wanting to leave the facility, and you said that was a good example, baby, because that's one for majority of my clients as well. So yes, that was like spot on.
Good.
Yeah, because a lot of them, like, their families have left them and stuff like that. So I think if we can, like, try to get them to realize the positive things that the LTC is offering them, then it might change how they feel about being stuck there.
Yeah. Change their belief about the situation. Yes. Good. Good. Okay. So you guys already know you're going to be turning in a decisional balance matrix with one of your clients this week. You're going to just attach it to your quiz like you would do your progress note. So it's going to be the same format. You have your 5-question quiz at the top, and then at the bottom, you'll have two parts where you submit your progress note for one, and then you submit your decisional balance matrix. So you can write out your decisional balance matrix, you can type it up, take a picture of it, whatever you want to do, but you have to make sure you submit both. Okay? You must submit both. Right? Any questions on the DBM? No? All right. Finals time. Okay. So your final will take place on October 7th. Okay. Your final is going to be during your normal class time from 4 to 5. At 4 o'clock, you guys are going to come in like you typically do. You're going to have 20 minutes to take your final exam. Remember, it's going to be multiple choice. You'll be fine. And then after you finish your final exam, you're going to meet with an instructor one-on-one, and we're going to give you your grade from your final exam. We're going to give you your overall grade, and we're also going to give you some feedback on the progress notes that you submitted for your final. Okay. So by the end of this week, you guys will be receiving an email from an instructor. It may or may not be me, but in that email, you're going to have the link for you to submit your 2 progress notes. You're also going to have the link for you to join for class, because you guys know you get on that link every week, whatever link I sent out when we first started TBS University. You're going to have a different link. It's going to be in the email that comes to you by Friday. Okay. Again, it may come from me, it may come from somebody else. There are about 12 or 13 of you guys in this class. There's only one of me. That's a lot of grading for me. And I also wouldn't have time to sit with you all each individually and go over all your scores and give you your feedback. So all of the trainers, we get together and we all help out. So that's why you could be getting your link from a different instructor, because they will be the one to grade your 2 progress notes, and they will also be the ones to meet with you one-on-one. Okay. So if you guys have not received that email by the end of day Friday, then shoot me an email and let me know. I'll reach out to your instructor and I'll make sure you get your email. Now, I'm off Friday, so if you don't get your email Friday, then send me an email Monday, but whoever's on my list, I'll make sure you still have your email Friday.
And you said we take finals what day?
October 7th. That is when you'll take your final. Any questions on that? And you guys already have, it should already be blocked off with the original link I sent. You have that blocked off in your calendar already. So then you'll be able to delete that and then accept the new one when you get it on Friday. Make sense? All right. Any questions on anything that we covered?
When are the progress notes due by for the final?
So your progress notes will be due the same time your week 10 homework is due. So it's always the day before. So
Okay.
your 2 progress notes for your final will be due October 6th by 4 p.m. Please make sure you guys are getting your homework and your 2 final progress notes in on time. Those deadlines, they're not really just to like hold you guys, I mean, yes, to hold you guys accountable, but it's also because as trainers, we have like full days planned, and we have to make sure that we have time dedicated to really looking at your progress note, giving you the best grade, giving you the best feedback. So if you can get them in early, please do so that we can really give more time and put more effort into the feedback that we're giving you guys. Okay. So in the deadline for your final 2 progress notes, that'll be in your email as well. But it will be October 6th, 4 p.m. And your final is October 7th, 4 p.m.
Now, do we have class next Tuesday also?
Yes, that's week 10.
Okay.
Yeah.
Okay.
You trying to get rid of me already?
No, I don't want to screw anything up.
Yes, no, we still have one more week before the finals. We have week 10 of empowerment. So you guys are
Yeah, because all that's like way more confusing than the homework ever thought it could be.
I see. That's hilarious. Y'all are funny. Okay. Any other questions, comments, concerns? No? Okay. If all hearts and minds are clear, you guys are free to go. Enjoy the rest of your week.
All right. Thank you so much.
You're welcome. Bye,
Bye.
guys. Jeez, that was, oh, let me stop recording.